One common question patients ask when they know that they need to undergo reconstruction is, how long will my treatment take? Unfortunately, the answer is not so straightforward because it depends on a number of factors. As a general rule of thumb, the fastest reconstructions are done if they only involve natural teeth, such as the case of grinding that we described earlier. If that's your situation, the overall treatment can take anywhere from 2 to 4 months to complete. The bulk of the time is really spent on getting used to the new height of the teeth that we are building and waiting for the lab to finish the prosthesis. Larger treatments involving dental implants can take longer. Dental implants typically take about 2 to 3 months to heal after they are placed in the bone. As such, the overall treatment time is now increased from 4 to 6 months. The slowest types of treatments involve multiple surgeries where bone grafting is involved. If we do need to graft to try and grow new bone, this is a much slower biological process and it can take up to 6 months just for grafting. In this situation, the overall treatment can take anywhere from 9 months to 1.5 years to complete. A common follow-up question, of course, would be how much would the entire treatment cost? And I'm going to be honest, it's going to be a huge financial investment. However, the good news is that because these treatments take such a long time, we are usually able to get you to a comfortable stopping point if finances are concerned and you need to save up before moving on to the next step. Whatever the case is, we want to ensure that you do have teeth that function throughout the entire rehabilitation process. So it's not like you're going to go for 1.5 years with nothing in your mouth at all. There's probably going to be a temporary denture or provisional of some sort while things are healing. We use a mixture of different kinds of provisionals, whether they are removable dentures to implant provisionals, and these are able to help you restore the aesthetics of your missing teeth. Functionally, they may not be as strong or as long-lasting as final restorations. They do require you to be a little bit more careful or come in for more appointments for maintenance. If you do think that you might be a candidate for a full mouth reconstruction and you're concerned about the entire process, we are open for a complimentary consultation. Come on in and we can do a thorough diagnosis and examination before we discuss with you what your situation is and how we can go about staging your overall treatment plan.